Hello everyone. Thank you for attending our webinar today on how to set a foundation in your organization to track evidence-based outcomes. My name is Nicole Hovey, and my job for our webinar today is to get your questions answered during our Q&A portion. If you do have a question, there is a Q&A button at the bottom of your screen. Please type your question in there and we will address them throughout the presentation. I would also like to introduce our host for the webinar, Kristen Frankum. Kristen is the Director of OutcomeTools at BestNotes, and she is the point of contact for setting up OutcomeTools for BestNotes customers and teaching them how to use the software to send and receive surveys. We also have Jake on the line. He is part of the executive team at BestNotes and has been researching the topic of value-based care. He recently attended the Open Minds conference where the focus of the conference was value-based care. He will also be available to answer questions today. Take it away, Kristen.
Thank you, Nicole. Thank you, everybody, for attending this webinar. We hope that this information will be useful for you. Today, what we want to talk about is healthcare changes that are happening and moving towards a value-based care system. We also would like to cover how you can start beginning measuring your outcomes if you're not already doing it. We would also like to show you how OutcomeTools works with BestNotes. So we'll show you a demonstration of OutcomeTools. This webinar will not cover payer models or any details on how value-based care will be set up. The goal is to show the importance of measuring your outcomes so you can be prepared to show the value that you're providing using data gathered from your clients. The big picture of value-based care has 4 different sets that we're going to discuss today. Where payer preference is moving towards integration that's driving value-based care reimbursement. They want providers to take a more integrated approach to the treatment that they're providing by looking at overall patients instead of an individual symptom. Next, value-based care is changing fundamental business models are organized. Here in Idaho, St. Luke's recently announced a restructuring of their organization to move towards a value-based care system by removing the chief operating officer position and adding those responsibilities to the chief nursing officer. That chief nursing officer will assume responsibility for the day-to-day operations. They're looking at components of the health system as cost centers instead of profit centers, as they were looking at profit centers when they were underneath a fee-for-service, and now looking at the system more as a cost center. Value-based care reimbursement is increasing in all types of health and human service financing as well, and we're seeing that. And then the success of value-based care is, to be successful, you'll have to use technology and use all the features of your EHR to be successful. You also will need to look at current processes you're using and evaluate if they are cost-effective and the best method of treatment for your patients. So how does that apply to your organization as a behavioral health provider? Behavioral health is slower to adopt a value-based care, and this is mostly because most providers don't use a standardized metric to gauge their outcomes, and small providers are reluctant to adopt expensive EHR platforms or technology. Several pilot programs are being put in place in the behavioral health value-based purchasing, but it hasn't been adopted by the larger population, and so those measurements are happening in silos. So value-based care relies almost entirely on data and measuring outcomes and quality, and in behavioral health, it's easier said than done. So we want to talk about some of the definitions that you will hear in value-based care. You'll hear fee-for-service, which is the current system where you're providing a service for an individual service and you're getting paid for that individual service. And the move to value-based care is the shift to provide incentives to organizations who consider the overall patient care, cost efficiency, and patient outcomes. You may hear integrated care coordination, and this is where you're bringing together multiple providers and information systems so that you can coordinate the health services, patient needs, and information to help achieve the goals of treatment and care for your clients. And then bundled services and payments, payers are only responsible for a single payment that covers all the services included in a defined episode of care. They can be administered as a bulk payment to a provider or divided to participating providers. So those are some words that you'll hear throughout the presentation, and when you hear value-based care, that you'll be able to understand the meaning of what those are. Some of the benefits of value-based care is that it drives down costs and improves patient care and population health. They financially reward healthcare providers for considering overall patient care, cost efficiency, and patient outcomes. In the new value-based care setting, healthcare professionals are encouraged to engage patients to provide care appropriate to each individual's circumstances. Also to invest in new technology and evaluate their processes, performance, and data so that they can align with multiple providers and take a team approach to healthcare. So why should you measure? The previous slide pointed out that investing in new technology will help engage patients so that you can align with other providers around the common goal of treating your clients, as well as allow organizations to evaluate processes, data, and performance. Outcomes will help you to have evidence behind your clinical decisions that you're making. And by using technology to gather this data, it will help you to communicate and collaborate with other providers with minimal effort and allow you to provide integrated care. As you use the technology, your clients will have the opportunity to be more proactive in their own care, and this allows consumers to be engaged, and it also drives the value of your organization. So you may feel some anxiety over adopting a new technology or adopting technology into your practice. And these might be some of the things. There might be some lack of trust, or you're worried about privacy concerns by putting in electronic data, or your usability. Is it going to be user-friendly? Does it meet any of my accreditation requirements for regulatory concerns? Will my patient be comfortable doing an electronic survey and inputting their data in? Can you manage your data, and is there enough infrastructure in your organization? And are your staff members willing to engage in this technology to be successful? At BestNotes, we want to help you to overcome these barriers so that you can understand what to do about them, and so that you can provide the best care without technology getting into your way. This is our mission statement here at BestNotes, is to help the helper so that you can do what you love and work with your patients without technology being a barrier. So value-based care has been a topic that has been on the market for a while. Dr. Michael Porter is a professor at Harvard Business School, and he's a cardiologist in Denver, and he has written several articles dating back even to 2005, 2006. And he wrote an article in 2009 about some of the features that value-based care need to have to be successful. And so some of these, I'm listing some of these. I want to point out number 4, EHRs will enable value improvement, but only if they support integrated care and outcome measurement. So what this is saying is that you can't fully utilize your EHR without using outcomes. And so we want to help you to do that within your organization. The other thing he said is all of those items on that last slide are very complex, but the real solution is so that we can align everyone in a system around a common goal, and that's doing what's right for your patients. So integrated care coordination is, currently the system is very siloed, where providers in the social, behavioral, medical are not coordinating as well or coordinating together as much. So in order to give better care, providers must work together to look at patients as a whole. An example of this is a 68-year-old patient appears as the perfect patient underneath a medical test payment program for a knee replacement. She was in the hospital for one night. She had no readmittance, no complications within 90 days. But she came to her post-operative appointment and she was miserable 18 months after surgery. Her x-rays looked good. She had a good range of motion post-op, no swelling or redness. So her doctor looked at her preoperative x-rays and saw very little arthritis. And what the doctor suspected is that the patient had significant anxiety, and it was manifesting itself as knee pain, and she was perseverating on that. So she became fixated on that pain as the source of her problem and went to a well-meaning surgeon who said, I know how to fix that, I'll do surgery. So the doctor's name is Dr. Bozick, who adopted this, and he now screens all of his patients for behavioral health conditions like anxiety and depression that could contribute to their pain prior to surgery. And that protocol wasn't in place at the time that that patient went in for treatment. If providers detect conditions, they advise patients to see an in-house therapist before agreeing to surgery. And since they made that change at this hospital in June of 2016, the practice has reduced the number of orthopedic procedures by 50%, and while increasing the number of patients treated using different modalities. So instead of care being siloed without a lot of communication across different providers, they're providing holistic care, which will allow providers to develop partnerships to provide the best care for their patients.
There's no doubt that value-based purchasing is here, especially in the physical care industry. Currently, over half of all the hospitals in the United States have value-based purchasing programs established affecting their inpatient care or inpatient stays. This has a big influence on how care is delivered to patients. I mean, many of these organizations, the majority of their patients that they serve are actually covered under contracts that require reporting for value-based purchasing contracts. The costs between the per member per month costs between patients with behavioral health diagnoses and patients without behavioral health diagnoses. We see that anywhere from 200 to 300% price increase in the per member per cost for patients that have a behavioral health diagnosis. And this is starting to get a lot of attention across different states and different paying sources. When surveyed in 2016, about 20% of the states, a little less than 20% actually, stated that that next year behavioral health reform was a big priority for that state. Value-based purchasing is coming to the behavioral health industry. What that model looks like, though, behavioral or value-based purchasing, as we begin to see it come on, we're going to kind of see it come on over a series of steps. It operates on a spectrum. You know, many behavioral health organizations are reimbursed through fee-for-service, where there's no quality metrics that influence their reimbursement. But as we move more towards a full value-based purchasing model, we see a transition from fee-for-service to pay-per-performance. And that's where we still have basically fee-for-service like billing, but our reimbursement rates are influenced by the quality measures that we can demonstrate to our paying sources. Furthermore, as we get closer to full value-based purchasing, payers begin utilizing case rates, bundled payments for reimbursements. So instead of being reimbursed for a specific service, you're going to be reimbursed for an episode of care. It's up to the organization to determine what is the best and most efficient way, effective way to utilize that money to treat a specific episode of care. As organizations then take on more risk, they'll see more payment models that are based off of capitation or population management, where the organization is in agreement of taking care of a defined population and receives a set payment from their paying source to take care of that population. Furthermore, in these models, as organizations start taking care of a population, they also have opportunities they'll also increase their financial risk. But as an organization, if you're able to achieve a cost savings as defined between the organization and your paying source, you'll see reimbursement bonuses. Value-based purchasing has been going on for about 6 years. We're starting our 7th year. And it wasn't until actually the last few years that we've seen these bonuses actually start to being paid out in significant amounts. For organizations or behavioral health organizations that are actually already taking part in value-based purchasing models is, increased care collaboration. Oftentimes, organizations will reference the collaborative care model, which was, I got to plug University of Washington here, which was developed at UW, where a team-based approach is used for treating depression and other common behavioral health conditions. Kristen's example that she used earlier is a good demonstration of a collaborative care model. But care is intended to become more patient-centered, as I stated, population care, where the care team tracks and follows up with individuals who are not improving instead of just providing ad hoc advice when needed. Measurement-based treatment will be required, where treatment plans will use symptom rating scales to track clinical improvement, evidence-based care, the utilization of best practices and improved processes, and accountable care, where we're treating a population. Organizations are reimbursed based off of their ability to care for a population.
So now that we've talked about value-based care, it gives you a good understanding of why you should measure because of the changes in payer reimbursement moving from fee-for-service to value-based care. Research has also shown that clients get better faster when they know that their outcomes and can see improvement over time. Also, there's an increase in regulatory bodies requiring measurement-based care. The Joint Commission put out their standard in January 1st of 2018 that all organizations must do client progress monitoring, and CARF is soon to follow that same standard. And you can't fully utilize your EHR without measuring your outcomes, so we hope that you'll consider that with your BestNotes. So what is the Joint Commission requirement? It became effective January 1st of 2018. They want you to use a standardized tool. They want you to measure at regular intervals and often. They want you to use the data that you gather to inform care, treatment, and services, and take that data and aggregate it across all your clients so that you can make quality improvement measures across your organization. We want to help you all decide how are you going to begin this process of gathering your outcomes. There's a few steps you can take. First, it's to decide what tools will provide data that show your effectiveness and value. We have a list of 50 tools and OutcomeTools currently, and we're always adding to that. If there's tools that you like to use or that you know will meet some of your requirements, we will take a look at the copyright of them and we can add them to OutcomeTools as well. We also want you to decide the frequency of how often you want your instruments to deliver. We can set those series up within OutcomeTools so that they'll deliver at regular intervals. Then once you decide your tools and you know how often you're going to deliver them, you'll need to train your staff on interpreting results and using those to inform your care, treatment, and services. And then you can take the results and use them within your documentation and BestNotes with your progress notes and your treatment plans and your MedClinical documents. And then using the performance measurement data to make changes in your organization within your processes or within how you're working with your clients on their treatment. So how do you choose an instrument? These are the requirements from Joint Commission for their client progress monitoring, is that you need to use a tool that's valid and reliable and one that you can see clinically significant change over time, and then one that you can also use as a repeated measure. There are some measures out there that are great tools to use, but they are one-time measures and aren't able to be used repeatedly. And you need to have one that has a clinical cutoff so that you can discriminate between clients who need services and those who don't. And you also can choose whether you're using an open source versus a license. Most of the surveys we have in OutcomeTools are open source, but we do have a few licensed surveys that are available. And the questionnaire library, there's a link here on the presentation that you can access those tools later. So when you're defining your data collection schedule within OutcomeTools, you can set rules that allow you to have surveys delivered at regular intervals. For example, if you had the YOQ 2.0 self-report and you wanted it delivered on admit and every 30 days until discharge, within OutcomeTools we can set those rules so that it will calculate off of the admit date or the discharge date if you're doing a post-discharge series, and it will automatically assign it to the client. It will deliver it automatically to the client if you're using email delivery. All other delivery methods, you will have to administer those to the client. A new feature that was just added to BestNotes now is that you can add a survey from BestNotes, where right here you'll see where it says instant survey and then the instance. You used to only be able to assign an instant questionnaire, but now you can assign a period of time from BestNotes without having to jump into OutcomeTools. We'd like to thank you all for coming. So now we would like to show you a demo of OutcomeTools.